If you have diabetes mellitus or prediabetes, or your healthcare provider believes that you're at a higher risk, you might have been instructed to get your hemoglobin A1c checked. In this video, learn what hemoglobin A1c is, what an A1c test measures, and what this information can tell you. A hemoglobin A1c test is a simple blood draw that tells you what your average blood glucose levels, meaning your blood sugar, has been over the last 3 months, which is approximately how long your red blood cells live. Remember that glucose is a kind of sugar in your blood, and the foods you eat are largely responsible for determining how much you have. Glucose is important because your body uses it for energy, so having the right amount is crucial. So you have glucose in your blood, and that glucose sticks to hemoglobin, which is a protein in your red blood cell that carries oxygen. If your glucose level increases, then that sugar coats more of your hemoglobin. This is what the A1C test is for. It measures how many of your red blood cells have hemoglobin that's been coated in glucose. So, do you need to fast for an A1C test? Some blood tests require you to refrain from consuming anything but water, usually within a certain number of hours leading up to getting your blood draw. That's because food can sometimes skew your blood test results. According to the American Diabetes Association, however, you do not need to fast before getting an A1C test. This is because, as we've now discussed, the A1C test checks your blood glucose levels from the last 2 to 3 months and not your blood sugar solely at that moment. Now, what does this have to do with diabetes? People with diabetes often have high blood sugar. This can happen because their bodies don't make enough insulin, which is a hormone that drives glucose into cells to be used for energy. Because an A1C test measures an average blood glucose level, it can help your healthcare provider better understand how your insulin is functioning, diagnose diabetes mellitus, or identify if you're at a higher risk of developing diabetes. If you already know that you have diabetes, you may still need to get an A1C test at regular intervals, typically every 3 to 6 months. This blood test is one way to monitor your blood glucose levels over time and ensure that they're staying in a healthy range. eNational testing offers an A1C test. This is a simple blood test that provides results within 1 business day. We have more than 2,700 locations across the United States and even offer same-day appointments. Should you have questions about your A1C test results, you can follow up with one of our clinicians. So, what are average blood sugar levels? What range should your blood sugar level be in? The American Diabetes Association says that if your A1C is less than 5.7%, your average blood glucose is at a healthy level. A1C levels of 5.7 to 6.4% indicate prediabetes. 6.5% or higher indicates diabetes. Now, what are the diabetes risk factors? You might be at an increased risk of developing diabetes, specifically type 2 diabetes, if you experience any of the following risk factors: carrying excess weight, especially around the midsection, a lack of physical activity, a family history of diabetes, prediabetes when blood glucose levels are higher than average but not yet enough to be considered diabetes, age. The risk of type 2 diabetes increases with age. Having polycystic ovary syndrome or PCOS, a history of gestational diabetes during pregnancy, giving birth to a baby weighing 9 pounds or more. Remember, if you have a diabetes associated risk factor, it doesn't equate to an automatic diabetes diagnosis. However, you should have a conversation with your medical provider and perhaps get an A1C test. You might also want to get an A1C test to check your blood sugar levels if you're experiencing any of the following symptoms: excessive thirst, more frequent urination, unexplained weight loss, sores that take a long time to heal, exhaustion, numbness or tingling sensations in the hands or feet, blurry vision, excessive hunger, darkened skin, often in the armpits and on the neck. Now, are there other diabetes tests? Yes, there are indeed other blood tests that can measure your blood sugar to determine if you have diabetes. These include the glucose tolerance test. This blood test measures your blood glucose before and after you drink a glucose containing liquid. Note that this requires you to fast in advance. If your blood glucose is 140 milligrams per deciliter or lower, this is considered normal. 140 to 199 milligrams per deciliter is in the prediabetes range. 200 milligrams per deciliter or higher is in the diabetes range. Fasting blood glucose test. The Centers for Disease Control and Prevention explains that this is similar to the previous test, except you don't consume any special liquid prior. You fast overnight and then have your blood sugar level checked. Blood glucose of 99 milligrams per deciliter or lower is normal. 100 to 125 milligrams per deciliter is in the prediabetes range, and 126 milligrams per deciliter or higher is in the diabetes range. Random blood sugar test. This checks your blood glucose at the time you're tested without fasting beforehand. If your blood sugar comes back at 200 milligrams per deciliter or higher, it indicates that you may have diabetes. There are other lab tests to check for diabetes, in particular for gestational diabetes. Your healthcare provider should guide you in picking the best way to check your blood sugar. Diabetes complications are no laughing matter. Left untreated or poorly controlled, diabetes can lead to serious complications, including kidney disease and ultimately even kidney failure. It can also affect vision, lead to neuropathy, and increase the risk of heart disease, among other complications. An A1c test is a simple way to check your blood sugar, devise a diabetes treatment plan, and get your levels in the target range. Providing a quick blood sample might be all you need to improve your blood sugar control and thus your overall health. While diabetes medication might be needed, lifestyle changes can also have a huge impact.